Tendons are soft tissue structures that connect muscles to bones. A long tendon band, called the iliotibial band, runs alongside the femur from the hip to the knee. The iliotibial band provides a connection point for several of the large hip muscles. A tight iliotibial band can cause hip and knee problems. A special type of ligament forms a unique structure inside the hip called the labrum. The labrum is attached almost completely around the edge of the acetabulum. The shape and the way the labrum is attached create a deeper cup for the acetabular socket. This small rim of cartilage can be injured and cause pain and clicking in the hip joint. The hip is surrounded by large, thick muscles. 3 gluteal muscles, the gluteus minimus, gluteus medius, and gluteus maximus, make up the muscles of the buttock on the back of the hip. These muscles extend or pull the thigh backwards, and abduct or pull the thigh away from the other leg. These muscles are also important for keeping the pelvis level as we shift the weight from one leg to the other during walking. The inner thigh is formed by the adductor muscles. The main action of the adductors is to pull the leg inward toward the other leg. The muscles that flex the hip or pull the thigh forward are in front of the hip joint. These include the iliopsoas and the rectus femoris. The iliopsoas muscle is a very deep muscle that begins attached to the lower spine. It travels out of the pelvis to connect on the inside edge of the upper femur. The rectus femoris is one of the quadriceps muscles, the large group of muscles on the front of the thigh. There's also a small, thin, strap-like muscle called the sartorius muscle that runs from the pelvis across the knee and connects to the upper tibia just below the knee joint. Several small muscles travel from inside the pelvis across the back of the hip joint and attach to the back of the upper femur. These muscles help to stabilize the hip joint and rotate the leg outwards. Together as a group, these muscles are called the external rotators of the hip. Finally, the hamstring muscles run down the back of the thigh. These muscles originate at the bottom of the pelvis. Because the hamstring muscles cross the back of the hip joint on their way to the knee, they help to extend the hip, pulling it backwards.